All right, we've learned a lot with Wendy. We're learning more all the time, aren't we? She says, so as I'm examining, she's bringing things up. So we learned now this time, not only did we have the car accident, we also had a bad fall or a collision, I wouldn't say a fall. And then we had 2 carpal tunnel surgeries. So a lot of things have gone on with Wendy, so she's a good candidate for us. So where would I begin? I begin in the cervical spine, right? We know that C3 is a big one. So I'm going to come in with nerve reset, and we're going to reset the nerve. Usually takes about 40 to 60 seconds. I start with 20 seconds of infrared and usually 20 seconds of red. So I'm going to begin right now. Now you can do this from either way. Usually I would be wearing glasses, but for videotaping and for educational purpose, I'm not. I'm mostly going to be on the skin. I need you to tell me if you feel any warmth at all. If I feel warmth, I can do 2 things. I can turn the energy down. I'm not opposed to the warmth because the warmth is great. It's bringing circulation to the area. It's increasing enzymatic activity of what's going on and promoting the healing. The laser works better than any modality in the world for resetting the neurology, and I can even feel the shoulder shifting just a little bit. From there, I'm going to go from infrared, which as you can see is brighter, to a red for another 20 seconds. Now, this is the start. I could also come anterior. So if she had a lot more shoulder involvement, I'd probably come anterior, but I can come either way because it's the peripheral nerve that's sending the energy and the signal into the central nervous system. There are 3 pain inhibitory centers in the body. 1 along the dorsal horn of the spinal cord and 2 in the brainstem. So if I could only laser one area for pain, where would it be? It would be the pain centers, which is in the brainstem, right? So that's where it's at. So once I've done that, then I'm going to come to number 3, right? So resetting the nerve is protocol number 2. Number 3 is for acute pain, but I'm going to go to chronic pain. So excuse me, I said 3, but I mean number 4. So I'm going to come back and I'm going to change this to protocol number 4, and we're going to come to this area. Now, I can come directly on an area or a trigger point, or I can paint the area. So you should be able to see some area being painted on the SEMs, especially the whole area there. And again, tell me if you feel any warmth. So Wendy, have you felt anything so far?
The last procedure you did right before you stopped, it was just starting to get warm.
Starting to get a little bit warm,
Yeah.
okay? So again, I'm
Not uncomfortable though.
not uncomfortable. I'm not opposed to that. Now the infrared's really great more for bringing circulation, increasing enzymatic activity. Now the red is important for nerve regeneration, cell proliferation, helping the cells heal at a faster rate. So using the laser in conjunction with resetting the neurology will increase healing times by 25 to 50% faster than normal. So I'm coming in the whole area and I'm painting that area first with infrared, and then I'm going to switch over to red. Okay, I'm going to come a little bit closer because I don't want to do too much scattered radiation. There is really no harm in doing the laser. No harm whatsoever that we can. We can't increase cancer, we can't wreck the thyroid, we can't do any damage. Sometimes we get a little bit of warmth. If you're too warm, we could have some skin irritation or something like. But you can't do any damage to the cells whatsoever. So I could keep this on this area as long as I'm not burning her for 30 seconds or 30 minutes. So I want you to understand we can be really safe with this. Now, we had 2 things that weren't working on muscle response testing, so I'm going to incorporate those 2 as well. So what I want you to do, even though she had decreased range of motion to the right, when we muscle response test her, it was her motions to the left. So I'd like you to slowly move your head to the left for me. Good. Tip it. And that's already smoother. I can see that smoother. Can you feel that smoother from the first time?
Yeah.
Absolutely. And then come back to center. Now, I'm an equal opportunity guy, so I'm going to have you tip your head to the right as well, and then come back to center. But I want to do more to the left than I do to the right. So I'm going to have you come back to the left for me. Good. Slow and purposeful as I'm lasering. Total time of this will be about 4 minutes. Come back to center, and then one more time to the left. All right? Nope, not to the right. We're going to do more to the left. Good. And I'm feeling it. She comes to the left. Can you feel that trigger point right where I'm under?
Yeah.
Absolutely. So I can come to that trigger point and I can hold it directly on there. Come back to center for me and relax. So again, I have a very easy to handle laser. I have red and I have infrared. And I could put this on trigger points. I can put it in the muscle. So it's so much versatile than any other laser I've ever used. Now, we're going to do turns. So I want you to turn your head, not tilt. There we go. And then we can feel that same spot. This is the area where she had the big trauma, right? Where you slammed into it. You can feel that trauma there. Come back and relax. I'm sorry, I'm talking. And so I know that we have some scar tissue in here. Would you bet you have some scar tissue in this area?
Yes.
Absolutely. So the laser is great for breaking up scar tissue and adhesions. So I love that part as well. Let's turn your head to the left here. As we do that, I'm lasering. So we're getting good laser treatment here while we're doing activities. So first thing we do, come back and relax, reset the nerve. Number 2, we come to the area that's an involvement or the affected area. And number 4 is we laser while we do activation. So turn your head one more time for me to the left. Good. So we're getting increased range of motion, good motion there, and just relax for me. Now, we've done that. Now, where's what the other place that we really need to come to? The shoulders were good, but we had some weakness in that right hand and elbow, didn't we? All right? So I'm going to let her, right? I have her. Might as well let her work to be part of the team. I'm going to have you take this laser, and you're going to hold it right here between the two heads of coronary arteries. This is where the median nerve comes through, and when those muscles get contracted, it squeezes or compresses the nerve, decreasing the frequency of firing. So it's sort of like that nerve, instead of being on 5 bars like a cell phone, it's being crunched and crunched, so it's only on 1 bar. When that happens, you don't necessarily have true weakness here, so the muscles aren't necessarily really weak, because I don't see a bunch of atrophy here. They're just turned down, almost turned off. So the laser is going to turn those things on immediately. And I think it's right there in the coronary arteries, but I'm also going to do the other spot just because it's so easy, and I have her working, right? So I don't have to do anything. I could be working on a trigger point. I can come in here to the carpal tunnel, but I want you to come and change this right there for me. So I'm on infrared first, and then I go to red. My standard procedure is I like to do both, because red has one biological effect and infrared has a different biological effect. If I combine the two, I get the best of both worlds. There's over 3,000 different researches on low-level laser therapy that have been out there with no documented side effects, so I get the best of both worlds, and you can feel it unwinding. So we hit the right spot right there. So I can tell you, if you hold that there, we're going to take this hand and we're going to pull that pinky to thumb together for me. Hold again. Hold. Feel the difference?
Yeah.
Dramatic.
I can feel something happening in my elbow too.
You can feel it, and I can sense it too, but I'm pretty sensitive to energy and moving and laser because I've been doing it for 20 some years, right? So you get to use some of my experience for doing that. So we know that this is a big spot. What would I do after this? I could come in and do some myofascial release. I could do some trigger points. I can break up this particular area, and that would be my next protocol. So I know what's affecting it. I know what's happening here. We're seeing major changes in literally less than 10 minutes of laser. And you can feel it, right?
Yeah.
She felt it, which is unusual, but you could see it in the strength was very, very dramatic. Now, once it's down, was that muscle weak? No, the nerve was turned down. Is it weak? Absolutely. It's not 100%, but it wasn't really as weak as we thought it was, which is the good part. So that's the good part. If it would have stayed weak, then we knew that we were going to have quite a bit of rehab, usually about 4 to 6 weeks. All right? So we good with that?
I'm happy.
Okay. You're happy so far. Well, if you're happy, I'm happy. But what did I say? I said function is more important than anything else. This is restoring function, right? Now, this is what I really want to see come back, is that we want to check the range of motion and the muscle response testing. So let's check the muscle response testing first. She was weak when we had her turn her head to the right for me. Look how much further that is. The range of motion to get a push up for me. Awesome. That was week before, right?
Mm-hmm.
The whole spinal turned off, right? All those paraspinal muscles turned off. Come back here, go back to neutral. You're doing good. And tip your head. Well, see how far she is. That's unbelievable compared. Can you see that? All right, and that's strong. So we know, based upon that, we're seeing increased range of motion, increased function, which is going to restore her. It's going to stabilize the joints and keep her from injuring when she's out there in the garden doing all the wonderful things that she likes to do. So to me, that's very wowish. It's very dramatic. I don't know how you could do it any faster or easy. It was a quick, simple 2-minute examination with about 8 minutes of laser therapy. So that's looking at the cervical spine and the shoulder. Okay? Now, did we have anything else involved? We had some decreased range of motion of the TMJ, which would be something we probably want to work on the next visit. All right? So that's the upper extremities. So we have the cervical spine, we have the shoulder, we had the elbow, and we had the carpal tunnel.